Welcome to today's video about 6 critical symptoms of ovarian cancer you must never ignore. Have you ever brushed off persistent bloating as just something you ate? Or told yourself that feeling exhausted all the time is just part of life? What if these common complaints were actually your body's early warning signals of something far more serious, even life-threatening? Ovarian cancer is often called the silent killer, for a reason. Each year, hundreds of thousands of women are diagnosed, and sadly, most of them are diagnosed at a late stage, not because they weren't paying attention, but because the signs are subtle, easily mistaken for normal health issues. In this video, we're diving into 6 real, research-backed symptoms that are often misunderstood or ignored. These are the signs that matter, the ones that thousands of women later wished they had noticed sooner. And stay with us till the end, because understanding these symptoms might not just save your life, but the life of someone you love. Before we begin, tell us in the comments where you're watching from. We'd love to hear your voice. Number 1. Persistent abdominal bloating. Feeling bloated after eating or during your period isn't unusual. But when this bloating becomes persistent, without any clear cause, or when you wake up every morning with a swollen, distended belly, it's time to pay closer attention. A study published in the Journal of Gynecologic Oncology in 2023 examined over 500 women. What did they find? 72% of those diagnosed with early-stage ovarian cancer reported chronic abdominal bloating as one of their first symptoms. This bloating isn't just uncomfortable, it's misleading because many people assume it's related to digestion or irritable bowel syndrome. In reality, tumor growth in the ovarian area causes inflammation and sometimes fluid buildup in the abdomen, a condition known as ascites. This fluid can make your belly appear larger, your clothes feel tighter, and cause a constant feeling of pressure in your abdomen. If this sensation lasts more than 2 to 3 weeks, it's crucial to consult your doctor. Number 2. Irregular menstrual cycles. Many of us, when our menstrual cycle becomes irregular, immediately think of stress, weight changes, or maybe a simple hormonal imbalance. But what if these changes are actually warning signs of something deeper, like ovarian cancer? Irregular periods mean bleeding that is unusual in timing, amount, or frequency. For example, cycles might become shorter, coming every 20 or even every 15 days instead of the usual 28. Or the bleeding could be much heavier than normal. Sometimes, menstruation might stop completely or only occasional spotting occurs. A large study published in the International Journal of Cancer tracked over 15,000 women for 5 decades. The findings were striking. Women who experienced irregular menstrual cycles during adolescence or adulthood had up to twice the risk of developing ovarian cancer. Even more concerning, this risk nearly tripled by age 77. Previously, many believed that fewer periods, due to irregularity, might reduce cancer risk because of less ovulation. But this research revealed that the real cause of these irregularities could be hormonal disturbances, such as chronically elevated LH or androgens, which themselves may stimulate the growth of abnormal cells in the ovaries. Doctors now recommend that if your periods have been abnormal for more than 3 months, whether in timing, flow, or type of bleeding, you should definitely get checked out. This is especially important for women who are not yet menopausal but have irregular cycles, or even those who experience bleeding after menopause. Our bodies are always talking to us. We just need to learn to listen carefully. Changes in your menstrual cycle, especially if they persist, are signs you shouldn't ignore. They could very well be what saves your life. Number 3. Pain during sexual intercourse. Sexual intimacy should be an experience filled with emotional and physical closeness, but when it comes with pain, your body is trying to send you a message. Many people attribute this pain to vaginal dryness, stress, or menopause, but if this discomfort persists, it could be a more serious sign, such as ovarian cancer. Pain during penetration, especially deep pelvic pain, can be caused by the growth of tumors in the ovary or pelvic area. These tumors may press on surrounding tissues, damage pelvic nerves, or cause chronic inflammation, all of which lead to pain during sex. A study published in Archives of Gynecology and Obstetrics in 2019 found that over 40% of women with early-stage ovarian cancer reported pain during intercourse. Many said the pain lasted for months but assumed it was due to simpler reasons like stress or hormonal changes. In some cases, especially among younger women, this symptom was the only early sign that eventually led to a diagnosis. Unfortunately, because many feel embarrassed to discuss this topic, they avoid telling their doctor, and this delay can have serious consequences. If sex has become a painful experience rather than an enjoyable one, and you feel pain deep in your pelvis or around your ovaries, it's important to share this openly and without fear or shame with your healthcare provider. Simple exams like transvaginal ultrasound can make a huge difference in diagnosis and treatment. Remember, no pain is normal unless you are sure the cause is harmless. Listening to your body is a sign of strength, not weakness. Number 4, chronic and unexplained fatigue. If you constantly feel tired, even after a full and restful night's sleep, and this feeling never seems to go away, it might be more than just a busy day or simple stress. Extreme and unexplained fatigue is one of the important and common signs in women with ovarian cancer, yet unfortunately, it is often overlooked. This fatigue is not just a simple feeling of sleepiness, it can severely reduce your ability to perform everyday tasks, and even affect your concentration, memory, and overall quality of life. Recent studies have shown that over half of women undergoing treatment for gynecologic cancers, including ovarian cancer, suffer from intense fatigue throughout the day, sometimes even feeling exhausted first thing in the morning. Why does this happen? Cancer cells can release chemicals that cause inflammation and alter your body's metabolism, resulting in severe fatigue that doesn't improve with rest. Additionally, frequent pain, anxiety, depression, and anemia that may accompany cancer also worsen this fatigue. If this fatigue persists and does not improve with simple daily activities, or even worsens, you should definitely see a doctor for proper evaluation. Chronic fatigue can be a warning sign of more serious problems in your body. Number 5, pain in the leg or thigh. It might surprise you that pain in the leg or thigh can be an early sign of ovarian cancer. Many times, this pain is mistaken for muscle problems, back pain, sciatica, or just everyday fatigue. But sometimes, the pain you feel, that constant pulling, numbness, burning, or aching, could be your body's way of signaling that something more serious is happening. This pain often appears as a deep ache or persistent cramping in the pelvic area, back of the thigh, or calf. You may feel it in one leg or both. Sometimes it comes with weakness, tingling, or numbness. Why does this happen? As an ovarian tumor grows, it can press on nerves and blood vessels around the pelvis. This pressure disrupts blood flow or irritates sensitive nerves, resulting in the pain you might have previously ignored. One case reported in the American Journal of Case Reports, 2024, described a 31-year-old woman who suffered from chronic sacrococcygeal, tailbone, pain and numbness in her right leg for 2 years. The initial diagnosis was musculoskeletal problems. But after further examination, it was discovered that a large mucinous tumor on her right ovary was causing the pain. After surgical removal of the tumor, her symptoms completely disappeared. This case is just one example showing how leg or thigh pain can be indirectly related to ovarian cancer, especially when doctors first suspect a herniated disc, muscle strain, or sciatica. But if this pain is new, persistent, or worsening, and occurs alongside other symptoms like bloating, appetite changes, or irregular periods, it needs serious evaluation. Our lower body is full of sensitive nerve pathways connected to the pelvic region. Pressure from a growing mass, even a small one, can cause problems that initially seem like just leg pain. But the truth could be something else. Number 6, unusual changes in urination patterns. Changes in how often you urinate, the urgency to go, or even discomfort during urination can seem like minor issues related to urinary tract infections or dehydration. However, when these changes become persistent and unexplained, they might be an important warning sign of ovarian cancer. Ovarian tumors growing near the bladder or pelvic organs can press on the urinary tract, causing symptoms such as increased frequency of urination, a sudden urgent need to go, or difficulty emptying the bladder completely. Some women also report pain or burning sensations during urination that don't improve with typical treatments. A study published in Gynecologic Oncology in 2021 found that a significant number of women diagnosed with early-stage ovarian cancer reported urinary symptoms weeks or even months before diagnosis. These symptoms were often mistakenly attributed to common bladder infections or other benign causes, which delayed further investigation. It is important not to ignore persistent urinary changes, especially if they occur alongside other symptoms like pelvic or abdominal discomfort, bloating, or fatigue. If you notice frequent urination, urgency, pain, or any other unusual changes in your urination patterns lasting more than a few weeks without a clear cause, it's essential to consult a healthcare professional. Early evaluation, including pelvic imaging and urine tests, can help identify if these urinary changes are linked to a more serious underlying condition like ovarian cancer. Listening carefully to your body and reporting persistent symptoms can make a critical difference in early detection and treatment. If you've made it this far, thank you. The truth is, ovarian cancer doesn't shout. It whispers, through symptoms we mistake for everyday problems. But you know your body better than anyone else. If even one of these signs sounds familiar, please don't brush it off. Talk to a healthcare provider. Because early detection saves lives, and awareness is the first step. Tell us in the comments, have you experienced any of these signs? What questions do you still have? Let's keep this conversation going, because someone, somewhere, might need to hear it.